Welcome to Motherhood. I'm Dr. Christina Hibbert, and I'm here, as you know, to help you overcome your challenges, to become the best mom you can be, and to flourish in this roller coaster ride we call motherhood. And I'm grateful that you've tuned in this week. Each week that you come back is just another week that you're becoming part of our motherhood community. And I love that we have this community going on here. And we've also started our community on Facebook. So if you're on Facebook, go look for our group called Growing Through Motherhood. We finally got some members going and some discussion going on. So it's another way to be part of the motherhood community here and to keep in touch and to grow together instead of just going together through motherhood, as we always say here. Now, today's episode is one that I've been wanting to do for quite a while because it's the topic that really got me started in psychology as a psychologist. And it's on pregnancy and postpartum mood and anxiety disorders and what every mom needs to know about those. And what we're really talking about here, that's kind of a long word. There's a couple long words, perinatal mood and anxiety disorders, a lot of terms we use for this. But what we're really talking about is postpartum depression and postpartum anxiety and all of those sorts of things that can happen emotionally after we have a baby. And I know a lot of you moms out there listening can relate. You've probably been through something like this, and I have too. So I'm excited to share this topic with you, and I have a fabulous guest. Like I said, I've been wanting to do this for a while and finally have the perfect guest who can help us learn a lot today. So whether you are a mom yourself, whether you just became a mom, or you're a grandma, or you're an aunt or a sister or a friend, this show is important for all of us because we all, whether we have been through it ourselves or will go through it, we're at least going to know somebody who's going through it because as you'll hear on today's episode, perinatal mood and anxiety disorders are very, very common. In fact, they're called the most common complication associated with childbirth. So stick around for that. Now, before we get into our topic, I just want to again, thank you for joining us here, and I hope that you guys are checking out the resources on my website at drchristinahibbert.com. Especially with this topic, there are lots of articles and resources about this topic and all the things we'll be talking about today, so be sure to go there and check those out, as well as my video, Postpartum Couples, which I produced as part of my dissertation back in the day and was selling for years and then got tired of selling it. So I just made it free online. So you can go and register there and watch the video for free online and share it with people. And it's a wonderful resource that's free. If you just go to my website, drchristinahibbert.com, on the homepage, you'll find free gifts and you'll see Postpartum Couples, and that'll lead you right to it. Okay, so as I was saying, I've been passionate about this topic, I guess now for 19 years because my oldest son just turned 19 and I had postpartum depression with all 4 of my biological children. Of course, I have 2 that are adopted and that had its own kind of postpartum-ish depression and whatever else was going on. But, when I went through this the first time, I was excited to be a mom. I had a degree in psychology. I knew about depression. I'd heard of postpartum depression. I was recently married to my, college sweetheart. I was, young and in love and excited to finally be done with college and finally be married and finally get to start our family and be a mom. And then I had the baby, and as we always say, I wasn't expecting this, right? It's kind of what a lot of people say when you get postpartum depression. You don't want to feel that way when you are, trying to be the best you can as a new mom. And I really struggled. In fact, my husband and I moved with our baby to my mom's house, and we ended up living on the floor of her living room for about 3 months while he was going to school and trying to work and trying to take care of me. And my mom and dad were there trying to help with the baby and trying to help me because I really felt like nobody understood, first of all, but secondly, I was the only one that could take care of the baby and no one could help me, and I didn't know how to accept help, and I wasn't getting any sleep. And so my mom was really the one who was able to force me to sleep and take the baby and try to help me get better. Now, I did reach out to my doctor. And back in those days, I told the doctor I think I might have postpartum depression or something. And actually, I didn't even talk to the doctor because, you talk to the nurse and they talked to the doctor. And then the nurse came back and said, oh, well, the doctor said to tell you that that's okay. It's normal. And we're going to send you some information in the mail. And they mailed me a pamphlet on the baby blues, which it wasn't the baby blues. It was definitely more than that. Now I know for sure. And it made me feel more crazy. It made me feel like, what's wrong with me? Nobody feels this way. I just wanted somebody to say, I feel that way too. I know how you feel. It's going to be okay. You're going to get through it. And so I kind of made a promise to myself that that's what I wanted to do. I wanted to go back to school eventually when I was ready, get my degree so that I could help other moms. I wanted to be part of the volunteer efforts to help other moms know that they're not alone. And, I ended up going back and getting my doctorate after my second was born. And I had postpartum again with him, even though I had a plan. And with my third, I had postpartum again, depression and anxiety, even though I was now a psychologist and knew a ton about it and had done my whole dissertation on postpartum depression. It still hit me, but I at least had resources. I at least knew where to turn. I at least knew what to do so I could help myself and let my family help me. And, of course, my fourth experience was like this crazy postpartum grief because, as many of you know, I had my baby 4 weeks to the day that my sister died, and my brother-in-law had died before that, and we inherited my two nephews, and then 3 weeks after that, we had the baby. So within a matter of 4 weeks, we inherited two kids, had another one, and we went from 3 to 6 kids. So that was sort of what my book, This Is How We Grow, is about, and, that was sort of my postpartum / grief / who knows what, all kinds of stuff going on there, right? So anyway, that's how I got into this work. And I've been part of Postpartum Support International for many, many years. And that's how I met our guest that I'm going to be introducing today through that fine organization. You can find them at postpartum.net, and also started here in Arizona, the Arizona Postpartum Wellness Coalition. And our warm line here. So we have a warm line, and whether you're inside Arizona or not, you can call our warm line at 888-434-MOMS. And Postpartum Support International also has a warm line and a fabulous website. So I just want to put those resources out there right from the start. Now, before I introduce our guest and we talk more about this topic, I want to do my Dr. Christie's Simple Solutions segment. So for today's Dr. Christie's Simple Solutions, I am thrilled to share with you a resource that I have found incredibly valuable as a psychologist myself. And this is for those of you out there who've been listening to our show and thinking, I might need some help, but I don't know where to go. Or maybe you've tried therapy in your community and you haven't found the right person. Or maybe you have things that prevent you from getting out to therapy, like transportation issues, or it's hard to leave home when you're a mom and you have little kids or babies around. And that's why today I'm so thrilled to share with you Regroup Therapy, which is an online teletherapy platform that you can access right from your own home. And today I have Justine Mitchell with me. Justine, welcome to our show.
Hi, thank you so much for having me.
It's such a pleasure to have you here and to have you tell us about this fabulous resource that I'm sure many of our listeners have never even heard of and don't even know is out there, yet it's such a valuable thing to know about. And, just to get it right out there, listeners, you guys can check it out at Regroup. It's Regroup, Group, therapy.com. So you can check that out. But Justine, tell us a little bit about Regroup Therapy and how it works and how people can access and how it's been received so far.
Yeah, absolutely. Thank you so much. Regroup Therapy is a HIPAA-compliant, secure platform for therapists and mental health professionals to use for video sessions with their clients or patients. So a lot of therapists and clients may use Skype or different platforms that aren't secure and aren't HIPAA compliant, which means they're not necessarily confidential or protected for their video sessions. But we decided that we really wanted to design a video platform specifically for therapists and therapy sessions. It's simple, it's clean, it's really easy to use. So if you're a therapist and want to do video sessions with your clients, it's a really easy system to use that is secure. and designed specifically for you. And then if you're a client or a patient and you see a therapist and you want to do some of it online, or you're looking for a therapist who uses online, you can tell them about regroup therapy or register with the site, and then look at a place like helppro.com where they list therapists who use our services, and then you can find a therapist who does video sessions on our platform.
That is so awesome. I was telling you earlier that I have done some teletherapy, and at first as a psychologist, I wasn't sure that I would like it. I wasn't sure that I would be able to connect as well with the client or help them as much, or that they would get as much from it. But I have been really surprised and amazed how well teletherapy works and how much my clients enjoy it.
Absolutely. I think, studies have shown that a lot of people actually prefer video therapy to in-person, not only because they don't have to leave their home and they don't have to pay for parking or commute, but also just because it's a nice way to interact with their therapist. And often a lot of times people actually forget that they're using video. They say that, once they get going and talking and communicating, the computer and everything else falls away, and then it's just a good interaction.
Yeah, I can say that I feel the same way. You forget that you're online, and I've heard that from my clients saying, I'm surprised how well this works. And, they kind of don't want to switch when I say, well, why don't you come into my office or something if you're in town? They kind of don't want to. So
I know. I think that oftentimes the hardest part is just doing it the first time, getting past any intimidation and just getting going. Because once it's going, most everyone really loves it.
That is so wonderful. Okay, so all of you listeners out there, if you've ever been thinking about therapy, or today as we're talking about this topic, this important topic of perinatal mood and anxiety disorders, there are those who specialize. I think, do you specialize in that as well, Justine?
No, I'm more of a generalist. I've had a private practice before where I worked with teens and adults on kind of general issues. I've worked a lot with Pec. I really enjoyed collaborating with her in Regroup, and I know she does a lot of perinatal work.
That's right.
But no, my history is more of generalist.
Okay, well, and see, so there's all kinds of therapists out there that specialize in whatever you listeners are looking for. And so remind us again how people can find the therapist or get hooked up on Regroup. So would they go to regrouptherapy.com to get started, or would they go somewhere else and find someone and then go to your website?
Yeah, if you're a client or patient and you see a therapist, you can tell them that you want to see them on video sometimes, and that they should go register with regrouptherapy.com, and then you can use that platform free of charge.
Okay.
If you're looking for a therapist who uses Regroup, the best way to do it is to go to helppro.com. Okay. And then there's a search functionality there that says that you look for a video therapist, and then all of the therapists in your state come up who do video. Awesome. And then you can contact them to see if they're a good fit.
Okay, so that's helppro.com and regrouptherapy.com.
Yes.
Okay. Well, thank you so much for joining us, Justine, and all of you listeners out there. Definitely go check this out. Pass it on to your friends, family, neighbors who might be needing this kind of help and might benefit from doing it in the privacy of their own home. Thanks, Justine.
Yes. All right. Thank you so much.
Bye-bye. All right. Fabulous. Now we finally get to the meat of the show with my guest, the very fabulous Dr. Pec Indman. Pec, welcome to the show.
Thank you so much, Christy. It's so exciting to see you again face to face. It's been, I guess, about a couple months since we saw each other.
I know. It's great. It's so great to get to see each other, and we say face to face because our listeners don't realize we're on Skype and we can see each other. So that's even better than just talking, right?
Way better.
I know. And Pec is just, for you listeners, I mean, she's just one of the warmest people I've ever known. When you're around Pec, you just feel loved. You feel happy and loved. So Pec, that's a great talent that you have.
Thank you.
You're welcome. That's why I thought you'd be perfect for this show. Obviously, you have a wealth of information on this topic. You teach about it all the time, but also just your way about you is so warm and inviting. So hopefully our guests get to listen to that and understand that as well.
Thank you.
You're welcome. So let me tell you guys out there a little bit more about Pec. As I said, Pec is a doctor. Well, Dr. Pec Indman, she first started off actually in family practice, and she was a physician's assistant, and she had her master's degree in health psychology, and then she went on to get her doctorate in counseling. And she's worked in a psychotherapy practice in San Jose for over 25 years. I mean, really a lot of experience. In fact, I'm trying to think, were you part of you might have been one that trained me back in the day, you know? She's been doing this for a long time. I feel like I've been doing it for a long time. She's really been doing this for a long time and trained a lot of people and done a lot of work in this field. And she has specialized all these years in maternal mental health. So again, a wealth of information here. She's also the former chair of the Education and Training Committee for Postpartum Support International, PSI, that I was just talking about their website earlier. And she has really been very involved in creating their curriculum for their 2-day trainings and teaching as well around the country and around the world, really, trying to educate providers and families about these disorders and what you can do. And it's a fabulous program. I've been very privileged to get to go and teach that program as well and be involved in creating it a little bit too. And it's a fabulous program. So if you're interested in more information about that, you can check that out at postpartum.net. Now, also, not to minimize the fact that Pec is also a co-author of a really fabulous book called Beyond the Blues. It's Beyond the Blues, Understanding and Treating Prenatal and Postpartum Depression and Anxiety. And that book you can find at beyondtheblues.com. It's a really great book because we used to sell it at all of our Arizona 2-day trainings because it's short, it's sweet, it's to the point, it has all the information you need, and it's just a great resource. So I hope you guys will go check that out. And if you want more information about Pec as well, you can find her on her website, which is Pec Indman, that's INDMAN, and Pec, PEC, PecIndman.com. You can find her there. And she also helped to create Postpartum Support International's DVD, which is called Happy Mom, Healthy Family. And it's a fabulous DVD, a very wonderful resource, nice and short to the point, something you'd want to check out as well. You can find that on postpartum.net. And not to mention, she's a mom of 2 darling girls. I remember them dancing for us at a conference one year.
It's a long time ago.
Yes, it was a long time ago.
Like 2008, I think.
Oh my goodness. Okay, yeah. That's what I'm thinking. They're probably not so young anymore. They're probably more grown up, right?
They're still darling.
Still darling, though. Of course. And of course, you can't. If you know Pec, you can't talk about her without saying she's a scuba diver, and she just loves fish. So I have a feeling she'll bring up fish at some point during this interview, but that's one thing we love about her. So again, thanks for being here, Pec. Okay, let's just jump right in. Our favorite topic. So first of all, let's explain. Maybe you could start by explaining, what do we mean when we use that term, perinatal mood and anxiety disorders? What are they, and what are the symptoms of those?
Wow, that's a big question.
It is. Let's start with, what is that spectrum all about? What's that term all about?
The old days, and again, I feel old and kind of chuckle when I say that, but we used to talk about PPD, postpartum depression.
Right.
And we've kind of dropped that term a little bit because it was very restrictive. And now what we talk about, perinatal, means all around pregnancy. So now we're talking throughout pregnancy and even throughout the first year postpartum. So when we use that term perinatal or maternal, we're talking 9 months of pregnancy and the first year postpartum. So that's actually a long time. Because now what we know is that some women get depression or anxiety or worsening of other kinds of mood or anxiety problems, bipolar disorder, those kinds of things during pregnancy, as well as during that first year postpartum. And we used to think, when I first started this work, as you said, around 25 years ago, that pregnancy cured everything and all women glowed during pregnancy. We now know that's not true. Mm-hmm. And a recent study actually found that about, I think it was 30% of women go into a pregnancy unwell, in terms of already having depression or anxiety or bipolar disorder or other kinds of mental health challenges. And that's an assumption that I had to kind of grapple with, that, we now know 50% of pregnancies are unplanned. And so, you don't always, that assumption everybody goes into a pregnancy wanting to be pregnant and emotionally healthy is not true. And that includes partners.
Right.
Mothers aren't always mentally healthy either. And so, again, part of this whole challenge has been really looking at assumptions and mythology that we've all had about pregnancy and motherhood, and really finding a lot of those myths were not only not true, but I'm so sorry, very unhelpful.
Hold on, we'll just...
That was perfect. It was my daughter. I thought I had turned off.
You can ask her if you need to. We can just like back up and start from, yeah. We'll just back.
I'm still in touch with her.
I love it though. I love that she's calling you during the interview. Okay, so let's see. Back up a little with what you're saying, and then just start over, and then I'll just splice it together later.
So that I had a lot of myths and false beliefs about pregnancy, going into doing this work and getting my degrees and all my experience. And not all pregnancies are wanted. 50% of pregnancies really are unplanned and not necessarily an optimal time. Not everyone, the woman who's carrying the pregnancy or the partner, is healthy. And that can all impact the pregnancy as well as the outcome.
Absolutely. And, I think you're right when we talk about, I think still people use the term postpartum depression probably most commonly. And what they're really meaning when they say postpartum depression is, like you said, this kind of bigger term that can include anxiety and other kinds of mental illness. And it doesn't just start after the baby comes, because I think a lot of people get confused by that term as well. Postpartum, right. Even if we use that term, a lot of people don't even know what that means. Right. But I like how you're saying, you're explaining this for our listeners, that it's from when you get pregnant and beyond that. And really it's kind of what before you get pregnant as well, because like you're saying, you can be unhealthy going into it, and that can just make things worse or harder.
So the other part is that it's not only depression, that now we know that during pregnancy and postpartum, there's often a big overlap of different kinds of situations. So some women don't identify as being depressed, but really they're anxious, or they're having scary thoughts that we now think is part of an obsessive compulsive disorder. And that having those thoughts can make you depressed. And so sometimes it's really hard to figure out what is going on with me. I know this doesn't feel right. I was expecting to be so happy. Everybody else expected me to be so happy. And I feel worried. I can't sleep. I'm not eating. And so we've kind of really changed the terminology a little bit to be more encompassing.
Right. Yeah, and that's such an important thing for our listeners to understand, that it's not just depression, and that's why we do call it these mood and anxiety disorders, this spectrum that we're talking about. So let's explain sort of the main disorders, what they are, and maybe just how common they are for each, and just I mean, I know that you agree with me that it's really important. We both feel that it's really important for families to be educated and to know what these are, so that like you said, it can be hard to know what's going on, but at least if you know what the possibilities are, you can sort of know what to look for, right?
And know how to seek help.
Yes.
Because, as you said, very often, unfortunately, providers are not trained well either. And that's why it's been my mission, your mission, Christy, I think we need to train consumers, all of you who are listening, families, people to do screening. And, the people we talk to, our midwives, our OBGYNs, our primary care doctors, and then also the therapists like you and I and our therapist colleagues, about how do we treat this.
Right.
And so I think the main ones, and it's not you go from one to the other. I think in the old days we also thought it was a spectrum of mild to severe, and it's really, they're different flavors.
Mm-hmm.
And I think it's important to understand you don't just snap and go from one to the other.
Well, you know what? Before you go into the disorders, let's talk for a minute about the baby blues, because it's not technically a disorder, right? But it affects up to 80% of moms. So tell us a little bit about the baby blues.
Okay. The baby blues, by definition, occurs Usually it starts within the first 3 or 4 days after the baby's born, and it should be gone in a couple weeks. And as you said, Christy, we think most women get it. About 70 to 80% of women get that. So in my mind, if most people get it, that's normal. I jokingly say we should label the people who don't get it because they're not in the normal range.
Right. Like the baby happies or something. What's wrong with those people? I
Right.
like that.
And the blues are so normal and they're mild. And I think that's important to remember. They're mild. I so clearly remember holding the baby and walking from one room to the next and bursting into tears and then going, what just happened? I was fine in that side of the room, and over here I'm crying and I don't know what's going on. That's pretty normal. And the blues really should be gone within 2, even 3 weeks. A lot of it, sleep deprivation, the oh my gosh, what was I thinking? Disappointments, you're exhausted, all those kinds of things jumble up. So the blues, we really don't consider a disorder or that it needs treatment.
Right.
Let me back up though, Christy, and talk about pregnancy because I think we really want to include that, many people go into a pregnancy, as we said, with depression or with anxiety or bipolar disorder. And sort of part of the mythology, I think, that we've all grown up with is, oh, you cannot take medication during pregnancy.
Right.
And there's a lot of controversy about that and a lot of new thinking and a lot of recent research. And so I just want to remind people, don't stop medication without really expert advice, because one of the things that happens is people get sick again during the pregnancy. And we know that can cause problems, that being depressed or anxious during pregnancy really is not good for your own brain or for the growing baby.
Right. And I was just putting together a presentation I'm doing tomorrow on this topic. And I believe the research says that it's 50 to 75% of those that discontinue their medication in pregnancy do have a relapse. So it is, and I want to help our listeners understand too, because I know you and I know this, but our listeners might not necessarily, that when you say get that expert opinion, it doesn't necessarily mean just your regular doctor or your OB or whomever, but keep looking until you find someone who really understands medication and pregnancy. Because as you're saying, as Pec is saying here, if you're on a medication and thinking of getting pregnant, or you're pregnant and a doctor says, oh, just let's go off of it, or if they won't let you take it when you're breastfeeding and you might think you really need it, keep looking, because it's kind of that risk-benefit ratio that we look at of the risk of the depression or anxiety on the baby versus the risk of the medication.
Right. We used to think it was okay to white knuckle it, oh, just 9 months, suffer, you'll get through it. Now we know that, it's not good for our own brains, but that having a baby who's exposed to extreme anxiety during pregnancy or extreme depression during pregnancy really can affect the outcome in terms of development and long-term well-being of the baby.
Yeah.
So
I'm glad you brought that up at the beginning, and we'll talk a little bit, we'll mention medication later in the show as we talk about treatment, but I'm glad you brought that up now, because that's really an important piece, and we don't want to forget that spectrum of pregnancy throughout. So we've covered the baby blues. We talked about a little bit about pregnancy and medication. Now, why don't you talk a little bit about depression versus anxiety, and there's different types of anxiety. Let's explain just briefly kind of some of the symptoms that people can look for, and how common are these things?
Right. Well, we now know up to about 1 out of every 5 women will have depression during pregnancy. Mm-hmm. That's amazing. And also postpartum, after the baby's born. And it may start right away where somebody just starts crying and doesn't stop past that point of the blues, or really feels very down. Again, the blues is mild. Mm-hmm. So, but it can start anytime in the first year. And the symptoms are often there's a lot of shame and guilt. How dare I feel anything but overjoyed with this little bundle that's crying and screaming, mm-hmm. spitting up on me.
Right, exactly.
There's a lot of shame and guilt, a lot of concern, oh my gosh, I'm not going to be a good mom. What kind of mom am I? Irritability is actually quite surprising to me, but very common. I mean, I think of my stereotype of a depressed woman as curled in a ball, crying, crying, crying. And when we did a survey of my clients who were depressed, crying was not very high up on the list. It was feeling like I can't cope, not just overwhelmed. All moms are overwhelmed. It is overwhelming.
It's part of the job.
Yeah, it is part of the job, but it's I can't cope. I'm sinking, I'm drowning. It's I feel like I don't know, there's often that overlap of worry and what's tomorrow going to bring, and am I going to be able to do this, and can I get through another day, and why aren't I feeling happy, and a lot of mixed, I never know how I'm going to feel in half an hour. Am I going to feel down or worried? Sleep problems are often very common, and sometimes it's trouble falling asleep because it's that, oh my gosh, what's going to happen? When's the baby going to wake up next? And what am I going to do? And what if I melt down? And what am I going to do tomorrow? And so sleep problems are very common. Loss of appetite or overeating, so rapid weight loss. People might come in and say, and I'm sure you've heard this, Christy, where, wow, I lost, 30 pounds in the first 2 weeks, but it's because I'm so anxious and my chest is tight, my stomach's in a ball, I can't eat. And everybody's saying, hey, you look marvelous, you're back in your jeans. But
because it's not a good thing necessarily. It can be a sign of something else.
Right.
Yeah.
So the weight eating may be difficult. And there's a key word in depression that we use, and I love this word. I don't love what it means, but I love the word. It's anhedonia. And it's when things that used to give us joy and pleasure are just bleh. So that, I used to enjoy a TV show, or I used to enjoy leafing through this magazine or looking on Facebook, and now I don't have the patience, I don't have the concentration, it doesn't appeal to me. Or I used to sing in the shower or sing in the car radio, and I'm not singing anymore. I'm not laughing at my partner's little jokes. And that's a key sign of depression, that people talk about, I'm not the mom I thought I was going to be. So those are kind of the main hallmarks of depression. People, like you said, feel all alone. This isn't me. I'm the only one. Every other new mom out here, every other pregnant woman is glowing or, gaga over their baby. And I'm not feeling what I thought I was going to feel. And the guilt and the shame are just so overwhelming.
Yes, it's so true. And, for those of you listening right now who are hearing what Pec's saying, sometimes you might even seem on the outside, or you're trying to seem like you've got it together. And, you might have a friend who seems like she's feeling great or she's got it together. But, if you really ask, and that's why I say the one of the campaigns that I love is you can't tell by looking, right? And so you need to ask. How are you really doing? Tell me the truth here. What's really going on? So that you can get to the bottom of that, because as Pec said, it's, this is 1 in 5 of all new moms we're talking about that will have depression. And that's pretty high numbers. And like we said, the most common complication associated with childbirth. And yet how many of us are preparing ahead of time, are talking about this in our childbirth education classes? I know that's something big that we talk about in the field a lot, is just how do we educate moms and families ahead of time so that you can prepare, so you can know what to look for, so you can know when you need to ask for help. So that's depression. And then we have this group called anxiety disorders. So if you could kind of just tease that apart a little bit, explain a little bit what each is about.
Okay. So general anxieties, people are just, and they often identify. I mean, you've heard this. I've always been a worrier, or my family calls me a worrywart. So people who just kind of have a tendency to worry, what about this and what about that, and what's this going to happen? And when you have a baby, you really have something to worry about, or even pregnancy. But it's that on steroids. It's so amplified. It's, oh my gosh, what if the things I hear so commonly, what if my child has autism, or what if they're not developing perfectly, or what about this and what about that, and oh no, and then this is going to happen, and they're going to get beat up in kindergarten, and then what's going to happen, are they going to get into college? And so the anxiety just goes on, and it really can affect sleep and appetite and just general well-being, and really get to the extreme. And one of the extremes of this, or one other kind of flavor that's considered an anxiety disorder, is obsessive compulsive disorder. Mm-hmm. And let me back up and explain what obsessive compulsive disorder is. And yes, many of you have seen it on TV, Detective Monk or Jack Nicholson in One Flew Over the Cuckoo's Nest. But an obsession is a thought that repeats. So, Monk needed order. Things need to be in order. Or Jack Nicholson was worried about germs and would wash his hands. Well, the obsession is the thought, oh my gosh, germs, it's contaminated, or pesticides, or, pollution. And the compulsion is the repeated behavior that's done to reduce the anxiety. So if you're worried about germs, then you wash frequently, or you're worried about order, you're moving things around frequently. And what happens around pregnancy, different than non-maternal times, is that sometimes women get scary, frightening, repeated thoughts. And sometimes it's like visual pictures, like movies. And sometimes it's about hurting themselves or the child. Yeah. It's horrifying. Yeah. And yet it's actually fairly common. We think around 3-5%, maybe up to 10 or 11% of women get this. And it's so common that our colleague Karen Kleiman wrote a book called Dropping the Baby and Other Scary Thoughts. Mm-hmm. What's horrifying is women actually may see these horrible things happening. And the challenge is these women are painfully in touch with reality. They are horrified. They think, and this is how you can tell, is this obsessive compulsive? What's going on with me? Is that you would never act on it. That thought is so unlike who you are and the person you are, that you would never hurt your baby. But it's horrifying. And those women really need a lot of help and support. That there's never been a case of a woman with obsessive compulsive disorder hurting her child.
Yeah, that's important for the listeners to hear that. That's really important. This isn't, and this gets confused a lot with psychosis, which you'll explain, which we'll talk about, but there has never been a report of a woman with postpartum obsessive compulsive disorder, pregnancy obsessive compulsive disorder who's ever hurt her child, right?
In fact, they're so frightened about these thoughts and frightened they will snap and act on them that they often avoid being around the baby, right, or avoid touching the baby if they're afraid they're going to hurt the baby. So
that can be part of the compulsion. Part of it is avoiding the baby. Some hide things like knives or won't go in the kitchen to cook because they're afraid that what if I did something? But that's all a sign that this is the OCD and not something like psychosis when you're not in reality.
Right. And let's talk about that now since you brought it up.
Yeah, go for it.
To kind of help with the distinction. Mm-hmm. So psychosis by definition means out of touch with reality. And for me, that's the big difference, that women with obsessive compulsive disorder are painfully in touch with reality, that they know, what a weird thought, I would never do that. Where did that come from? People with psychosis are out of touch with reality. So they may hear things, they may hear, sometimes it's religious thoughts, they may hear the voice of God, they may believe something that no one else believes. For example, I had someone who believed her father-in-law was Jesus Christ.
Oh, wow.
No one else believed that.
Yeah.
One of our colleagues talked about a client who heard her breasts talking to her. Wow. And she was very frustrated because no one else heard that.
Right.
Yeah. Mm-hmm. I had someone whose newborn baby was talking to her. Well, no one else believed that. No one else thought that was accurate or true. And so that signifies out of touch with reality, hearing, thinking things that no one else believes are real.
Right.
And that's where it gets scary. Sometimes these women are very confused. They have trouble speaking. They're not thinking clearly. And we really consider that a medical emergency. Those women need to be taken to the hospital and started on medication. And it's actually fairly rare. Right. We think maybe 1 or 2 out of every 1,000 deliveries, those women might develop psychosis. However, it does happen. We need to know about it. And sadly, those are the cases that hit the news and often are mislabeled postpartum depression. And that was something that happened a lot with the Andrea Yates case.
Right. And then people get confused. They don't really know what's what, or they think if I get depressed, I'm going to become like Andrea Yates, who, as most of you know, killed her 5 children because she thought that she was being told to do that. She was saving them. I mean, that's what her belief was, essentially. And we did our show 2 weeks ago. We did on the dark side of motherhood, shedding light and hope on the dark side of motherhood. And we talked about a couple of women here in Arizona, one who ended up abusing her baby because she was in a psychotic state, and another one who ended up taking her baby's life because she was in a psychotic state and eventually took her own life. And so, what Pec's saying here is important, first of all, to understand the difference between OCD and psychosis, which I know you get this too whenever we teach about this. That's one of the biggest questions is, how do I know the difference? And what Pec is saying is really important for you listeners, because we don't want to freak you out. We just want you to be informed and to know that, yeah, if you or someone that you love is struggling and feeling like, why am I seeing these images in my head? Why am I walking past the stairs? And instead of just feeling like, oh, I don't want the baby to fall, and you get a little nervous, you actually see an image of the baby falling over the stairs, and it's disturbing. And so you avoid the stairs and you don't ever want to go there. And, I've had, like you said, clients who have won't sleep in the same room with the baby because they're afraid they might do something, and they'll lock their door and the baby's door and make their husband sleep in the other room with the baby. And, they go to extreme lengths to protect the baby, versus the psychosis, which is, it's like you say, it's almost like a personality change. You just know something's not right. They're not believing the right thing. They're not acting like themselves. And that is much more rare, but also very dangerous, and it requires immediate treatment.
Right. Absolutely. Right. And the hard part is people don't just come into a doctor's office and say, I'm having the weirdest thoughts about XYZ with my baby.
Right.
And, so it's really important to, observe, does this mom, your sister, your relative, your friend look and appear comfortable with the baby? And, that is kind of a warning sign. And this is treatable. That's the important thing, that no one needs to suffer.
They're all treatable. And I think you're making a really important point that, we pay attention to how people are reacting and responding. And also, I mean, on the one side, yes, people who are psychotic don't know they're psychotic. So they're not going to say, hey, by the way, I'm having these psychotic thoughts, because that's the definition of psychotic, is you're not in touch with reality, right? So there's that. But also, women who have the OCD thoughts are often very afraid to come forward because it's so scary to them, and they're afraid that someone's going to think they're psychotic. And unfortunately, we both know that there have been many cases where, they were considered psychotic and their child was taken away by CPS or something. So if you don't know, if you have a provider that understands these things, this is where a resource like Postpartum Support International is wonderful, because there's coordinators in every state. You can talk to a Worm Line volunteer. You can go online and get help to help you figure out what's going on and find somebody that might be trained or educated through these programs like Pec teaches, to help you understand what's going on. And that's safe. And like me, like all of us, yes.
The other thing that I think is really important to remember is, because of the media portrayal that Andrea Yates had depression, people think that wanting to hurt your child is a symptom of depression. And I really want people to know, moms and friends, that hurting your child is not a symptom of depression. That I don't think in 25 years I've ever seen a mom who wanted to hurt her child. And people often will be asked, well, do you think you have postpartum depression? And they'll say, well, I don't want to hurt my child. I totally believe that, but that doesn't mean they don't have depression. That depression is about sadness and grief and loss and overwhelm.
Right.
So
That's
I
a
think
really
it's
important point.
to mention that.
That's an important one because we want people to listening to identify what's going on and not to push it away because you have the wrong information. So it's two very different things. You know, the part about hurting your child is usually a part of a psychosis or some other kind of pretty serious disorder going on versus depression, which, you know, it's just you just don't feel good. You don't feel like yourself. You don't feel happy. You don't know what this whole experience is all about, and you don't know what to do. And that's what I kind of want to focus on. Well, before we do that, we also want to mention postpartum post-traumatic stress disorder, which is another form of anxiety disorder that can happen after childbirth in about 1 to 6%, I believe.
Yes. And interestingly enough, and postpartum, post-traumatic stress disorder really became sort of a real diagnosis after the Vietnam War. And what they were finding is veterans were having flashbacks. They were reliving their experiences in the war. They were having anxiety. And any kind of traumatic event, whether it's your own personal during your birth, for example, or your partner observing the birth, for the nursing and medical staff observing the birth, we now know that all those people can develop what we call post-traumatic stress disorder. As Christy said, it's about 1 to 6%. Most recently, some of our wonderful colleagues did a study and found that about 35% of women actually felt their births were traumatic. They may not meet all the diagnostic criteria for post-traumatic stress, but many women felt very traumatized by their births. And one of the common themes was about not feeling respected, that people would come in and do exams and not even introduce themselves or give any warning, or that they felt like the providers talked over them and didn't include them in decision making. So it's not uncommon. I mean, that was a pretty shocking number, 38% of women feeling that they were traumatized by their birth.
Wow.
Post-traumatic stress has specific criteria, and it is things like having flashbacks where you remember and almost relive that experience of having whether it was almost bleeding out or being told your baby wasn't breathing. Those women have a lot of anxiety. They're kind of scanning the environment, waiting for something else bad to happen. Often there are nightmares. And again, these are all treatable with therapy. Sometimes medication is necessary as well. But yeah, that figure was really shocking to me, especially when they went in and asked the providers, the healthcare staff, the nurses and the physicians, did they think that was a traumatic birth? And many of them actually thought they were very routine.
Right, because they're used to this, but when you're having the baby, I mean, like you say, it's really relative. It's your experience and what you perceive as traumatic, not what the doctor thinks or somebody else. That's right. But that is a really high statistic. I am surprised by that too. I hadn't heard that that statistic.
The article, which is so wonderful, by Cheryl Beck, who's a midwife and PhD college nursing professor. But it's called It's in the Eye of the Beholder. Oh. It is so much about how we interpret. And, you know, you're right. If you didn't know it was going to be a bloody mess, it's going to be horrifying. The healthcare providers expect it to be a bloody mess.
Right. They do this all the time. No big deal.
I remember thinking, wow, who knew it was so messy?
Yeah, exactly. Well, and so, okay, so these are the spectrum of disorders. And it's funny because, you know, Pec and I were preparing for the show and we're like, how do we condense 2 days worth of information into a 45-minute interview? But so we're going to shift gears here because, you know, as Pec was just saying, these are very treatable, all of these disorders. And that's the hopeful part of all this. It's not, you do get through it. You do move on. You do grow through it and become, you know, you can become the mom that you want to be, even if it feels really hard at the start. And that's what we want to kind of focus on with most of the rest of the show. Before we do that, I want to share, you know, a couple of the thoughts on why. I'm sure a lot of you listening out there thinking, well, how does this happen and why? And, there isn't any one specific, we can't say, well, this is why it happens. It's kind of a unique mix or cocktail, so to speak, for each one of us, what happens. And in general, the thinking is that there are kind of three main ideas of biological factors, psychological factors, and also a pre-existing vulnerability to this. So can you speak to that just in a few minutes, a little bit about why does this happen?
Sure. And when we talk about risk factors, it's really important to go back and talk to people about their family history, which I find is a big, often closed closet. Many people have family members who have had mental health problems, and it's never been talked about. It's never been diagnosed, never been treated. People talk about, oh, my mother had a nervous breakdown. Well, in the healthcare field, we know that that's really not a real diagnosis, but clearly it means something, that someone had a mental health issue. Many people have family members who've been undiagnosed. I think it's important to look at have there been any suicides in the family. Anybody who has a family history, but also a personal history, again, diagnosed or not. And we didn't really talk about things like panic. If somebody's had panic disorder, it's not uncommon for a new mom to end up in the emergency room with trouble breathing and feeling like she's dying and smothering, and really she may have had a history of panic disorder before.
Right, that's another disorder that you're right, we skipped that one, but panic disorder affects up to 10% of women, I think, and maybe even 6% in pregnancy, I think is the numbers.
Yep, and also bipolar disorder. And again, many people are undiagnosed, and we know now, and I was horrified when I found this out, that the average person goes 10 years with an incorrect diagnosis of bipolar disorder, that it's not always that huge manic depression we sort of think about where somebody's dancing on the roof or the ceiling and bouncing off the walls, but it may be just a mild kind of, moodiness. And so I always ask people, would people call you moody? Women who have premenstrual mood changes are at an increased risk of postpartum depression, just because postpartum, you have the baby, your hormones drop, and we think people may just be more sensitive to the change in hormones. So I think personal history, psychological history, and I find many people have never been diagnosed, but it was just, I had to come home after my first year of college. I didn't feel right. And they were depressed. Nobody ever labeled them or diagnosed them. They never got treated. But so personal history, you mentioned your own personal psychological factors, having the death of a family member. Brooke Shields, in her book, Down Came the Rain, talks about her dad dying right before her baby was born. And social support. We know moms who are isolated, who don't maybe have a partner, or teen parents, or parents who have babies who are in the neonatal intensive care unit. All of those are other kinds of risk factors, that vulnerability. And women who have been on medication and stop, that they're at, as you said, an increased risk, in some cases up to 75% chance of getting ill again during the pregnancy, or certainly postpartum, because you add, it is stressful, you're not getting good sleep, and it's like pouring gas on the embers of a campfire.
Right, and unfortunately, a lot of people have that wrong. They think that, well, if you're depressed in pregnancy, that's okay, because once I have the baby, I'll feel better because I won't be pregnant anymore, But really, it's kind of the opposite. Usually it kind of makes it worse.
Now you're sleep deprived, and you have something really that does demand
I know, and all those hormone shifts, and plus labor and delivery and everything else going on. And yeah, you're right. It's a big shift. I mean, we all know that. If you're listening and you're a mom, you know what it's like. It's a huge shift, and that's why we can kind of chuckle when new moms are kind of, putting their plans out there of how it's going to be, and you're like, oh, yeah. Good luck with that.
Yeah.
Reality is a little different, right? But it's something to, as Pec is saying, to look into these risk factors so that you can be prepared. and if you have this family history or personal history, and I appreciate what you said about it's not talked about. And hopefully this is the generation where we start to talk about it. And that's one reason why I wanted to talk about this topic and to do this show and to do other shows like our show we did on motherhood and depression in general, and our show on that I mentioned earlier about the stigma around the dark side of motherhood and how we can help moms with that, because the more we talk about it, the more it becomes normal to talk about. And I remember when I was depressed, when my grandmother finally found out that I had postpartum depression, because I didn't really call it that for a while, and then eventually down the road I started saying, yeah, I had postpartum depression and teaching on it and doing different things. And she said, oh yeah, I had that. And I said, you did? What do you mean? And it turns out she was so depressed that one day she was bathing my youngest uncle, and she said that she kind of zoned out. And when luckily something kind of shook her out of it, and when she looked down, he was under the water. She was sitting right there. She just was so depressed that she had zoned out, but that was forever ago, and you don't talk about that. So it is important for us as the younger generation comes up to ask our grandmothers, our mothers, our family members what it was like for them.
Yes.
Good information.
And they'll feel comfortable telling the truth.
That's right. Yeah. Then we can all talk about it, and then we can help those who are, just like you say, to not have to struggle. So let's focus the rest of our time, which we only have like 15 minutes here, or maybe even less, on treatment and what we can do about this, because, there is so much information, and, you are just a wealth of information on this topic. We could spend days on this for sure, but let's focus on first the self-help ideas. So kind of the idea is, if you have mild depression, maybe you can start with some self-help at home. And then if that's not working, or if the depression is getting worse, then you might need some more professional kind of treatment methods. So let's talk about what are some of the main self-help methods that our moms can try.
For that, I even want to say the goal is not just to feel better. The goal, the realistic expectation is to be well. It's not to survive, it's to thrive and flourish. And I think better is not good enough. And so I really push people, and I tell my clients, I'm going to keep poking you in the ribs with my elbow, because the goal is really wellness, and to be the mom you had hoped you were going to be and thought you were going to be, and to really be thriving and flourishing.
I'm a fan of that, because I wrote about that in my book, and I say it all the time that I don't want to be better. I want to be better than better. I want to be the best I can be, and not in a pushy kind of way, but yeah, to encourage the moms out there, I think that's brilliant, that you can, as we say, not just overcome the challenges, but eventually you can flourish. You can be the mom you want to be, that you dream of. Yeah.
Yes, and I think it's so important for everyone to know that is a realistic expectation.
Yes.
That the motto of Postpartum Support International is, it's not your fault. You're not alone. 1 out of every 5, and with good treatment, you will be well. And I think that's just critical. So what works? Okay, sleep. Sleep is so essential and so elusive and hard to, the babies don't read that, they don't get it. But it's really, I think, and you said this, Christy, about accepting help, that maybe what we know is stretches of sleep are so important, that 2 hours really scrambles the brain. And so it's, how can you get, even if it's 3 or 4 hours, maybe doing a first shift, letting somebody else take another shift. But sleep is really such a big piece of the wellness plan. And if you can't fall asleep, if everybody else is asleep in the house, then you may need to talk to a professional about what are things you can do. There's even online, it's called sleep hygiene, things like, don't sit in front of your iPad, because the light from the iPad or your phone will stimulate the brain to think it's time to wake up. So look online, just Google sleep hygiene.
Great.
That's one thing.
Great tips.
Another self-help thing is, if you're anxious, please stay away from Dr. Google, because there's so much bad information out there that is touted as expert, and nobody agrees, and it's fuel on the fire. Years ago, someone I went to a lecture about anxiety, and the professor, whoever he was, the expert, said caffeine is the number one enemy of people with anxiety. Well, I'm going to put it number 2 now because that was before the internet. Now
Yes.
it's number 1.
That's right. But caffeine isn't good either if you're having anxiety. Just keep that in mind. But yes, Google, no good.
So, if you're anxious, and stay away from things that are kind of scary and activating. I don't read the news. Don't, ask somebody to give you important things. But the news is very distressing, and they don't have good news. It's all about making us more anxious. So people with anxiety need to do that self-protection. Eating, and if you're too anxious to eat, then maybe get a protein shake. Have somebody bring you a protein shake or make you a shake. But it's important to have small, frequent caloric intake, especially if you are nursing. But even if you're not, you need to keep your stores of protein and fluids up. So drinking water, drinking juice, eating, I remember, I spent a lot of time on the couch feeding the baby. And so, have water nearby, have little cups of nuts or things you can snack on and eat with one hand. So also social support is so critical, to know you're not alone. Postpartum Support International, we keep talking about it. We've been members for many, many years, so we certainly know it well. But we're about to launch support groups online. And
So great. Such a great resource.
Technology is wonderful. Also, that warm line. A warm line, it's not a hotline. It's not a live body 24/7, but it's somebody will call you back who's going to say, did you eat today? What's in your fridge? Can you sleep? Can you grab a nap? Can you get out in the sunshine? Can you go for a walk? So developing social support. And the hard part is if you're not feeling well and you're not feeling like you're a good mom, and you go to a group at the hospital where everybody is perky and doing well and it's easy to make you feel worse. So the beauty of what's going to be our online network will be you're going to be with other moms who are also struggling.
Right, and they get it. And PSI is such a great resource because it's good information. It's you can trust what they're giving you. So that's a great thing to check out. When is that supposed to be up? Do you know?
In a couple weeks to a month. I'm not exactly sure.
Okay, so depending on when you're listening to this, it might already be up or it might be coming soon, but postpartum.net is where you can find that. So these are great resources for self-help. And of course, you mentioned some other things at the end there, like exercise is great and light therapy is a real thing. Getting in the sunlight is great. And, just being with friends or time alone, a lot of us need that, naps, whatever you can do.
Recharge batteries.
What's that? Recharge your batteries. That's right. I actually have a great article on my website about time alone and 25 ways to get time alone, because a lot of times you say, I don't know how to do that. It's impossible, but it's not impossible. So go check that out if you need some ideas. But sometimes self-help isn't enough. And I want us to be able to spend the last minutes here talking about what both you and I do, which is therapy. And it's, I know back in the day, they used to always sort of talk about medication as the first line treatment option. There's a fabulous article by Michael O'Hara, I think, and I think it's by Stewart and O'Hara, actually. And, they finally came out several years ago saying that therapy should be considered the first line treatment, which is what we've always thought. But we're kind of biased, but the research backs it up because it's a great place to start, because you get to talk about things and you get to learn new skills and you get to learn about yourself and new ways to do things. And as you said, though, I don't want to leave this piece out. The medication can be very important, and we don't want to minimize that. There's also an article on my website if you guys want to look it up. It's on antidepressant or not, and some 10 facts that you need to know on whether to take the antidepressant or not. Now, in some cases, like in psychosis, you might need more. You'll need more than an antidepressant, and Sometimes it's an antidepressant and anxiety, whatever those medications are. In extreme depression, extreme anxiety, you will need help with medication. With OCD, usually medication is indicated to help stop the thoughts and the images. But we're going to focus on therapy. So we want to make sure you know that medication is a really valid and great option. And as Pec mentioned in the beginning, it's not something that you want to just quit if you're already on it, or discount if you want to breastfeed, but you need to talk with somebody who's really knowledgeable about that, because it's not something that you have to just give up like that so easily. But let's talk about therapy. And Pec, specifically, I know you wanted to talk a little bit about cognitive behavioral therapy. Explain to our listeners what that's all about. Because I'm a fan too. I love it. So
I know you. So there's many different kinds of therapy. And when people call me, I really upfront, right from the beginning, say, I'm not going to do what you see on TV. I'm not going to say, how did that make you feel? Honestly, that would really annoy me. Right. Cognitive behavioral therapy really works from the idea that if you're anxious and you come in and I say, change the feeling, chill out, relax, you'd want to punch me.
Yes.
People have been saying that to anxious people forever. It doesn't work. If you're depressed and somebody says, cheer up, look at all the things you have to be happy about, you would if you could. Nobody, I don't believe, likes feeling down. Mm-hmm. And this model looks at, it's hard to change how you feel. It's hard to change your physical reactions, whether it's an upset stomach or trouble breathing. It's easier to change how you think about something and or how you act. And we've all heard the expression, fake it till you make it. Babies need moms to smile. They need that sing-songy voice. And even if you don't feel it, often when you act that way, if you start smiling towards your baby or your toddler or whoever, sometimes those feelings follow. You go, oh, this isn't so bad. That's your thought. And then you start feeling more relaxed and comfortable. The thoughts are, moms often come in and say, I'm a terrible mom. I'm the worst mom on the planet. And my big question is, what's the evidence? Mm-hmm. And, and I'll say, did you change that baby's diaper today? Of course. Most moms are changing diapers. Did you feed the baby? Yeah. Did you put on a dry onesie? Yeah. Oh, you're a great mom. Mm-hmm. And so I really talk a lot about the evidence. And cognitive therapy helps people change the lenses in their glasses. If you're depressed, everything looks crappy and terrible. I'm the worst mom. The goal is, how do you get to neutral or good? You know what? The baby was crying. I picked him up and talked to him. Oh, the baby was crying. I fed her. And so part of it is helping moms change the belief system. That's cognitive therapy. And to help you get to neutral or good. And even, when bad things happen, like you may not be able to stop the baby from crying. Babies cry several hours a day. That's part of their job description. But I can feel like I'm a good mom because I responded. I rocked him, I talked to him, I fed him, I looked at, are they hot or cold, wet or dry? So cognitive therapy has really been shown to be very effective, both pregnant, non-pregnant, for everyone, for depression, anxiety. I like to think tools-based and practical. I like to think people go home the first visit with some real different ways of thinking about things. And I explain the model, and it's just, I love it. And so the key for those of you listening is to interview therapists. And on my website, PecIndman.com, I have questions because I really want people to be good consumers. A lot of people say, oh yeah, I've worked with postpartum depression. Doesn't mean they know anything about the unique features. And so ask them, what model of therapy do they practice? If they practice long-term psychodynamic therapy, that's not been shown in the research to be effective. And I find moms just want to get better and go hang out with their babies.
We don't have time for years of therapy, right?
Appropriate. And so you want to ask what kind of therapy, what model. If somebody can't give you a good answer, I would move on to the next person.
Yes.
A lot of people are, oh, whatever works. It's like, nah, I'd go with somebody who knows what they're doing. Interpersonal therapy is another kind of psychotherapy that's really been shown to be effective with maternal mental health.
Yes.
Can they recommend any books on the topic? Yes, I have written the book, but if they don't know
Beyond the Blues, everybody, Beyond the Blues, yes.
Yeah, if they can't, then they don't know the subject.
Right. Or I always say, have you ever heard of Postpartum Support International? Are you a member of something like that? And people that haven't ever heard of that probably don't know much about
right.
The
There's only about 3 organizations internationally around perinatal
society. Yeah, exactly. There's not a lot. It's not like there's so many that they wouldn't have heard of these if they
if they were really involved. You would expect they would know.
Right.
Yeah, books, organizations, and training. Have you had any specific training? I have all these letters after my name. There was not one mention of anything related to maternal mental health.
Mm-hmm.
So you really want to ask those questions, and then perhaps through regroup or other ways, find somebody who really is skilled and has expertise in the topic.
Yes.
Therapists are people, and we all have a lot of misconceptions as well.
That's right. And I'm really glad that we're kind of wrapping up on this topic because it is hard. It can be hard to find the right therapist, the right doctor, provider, whatever you're looking for. But Pec's advice here is so important that we keep looking and ask the questions. And I love that they can visit your site at Pec Indman, INDMAN.com for some questions, some ideas of what you might need to ask if you're not sure, to find the person that's going to help you. Because again, like Pec said, the PSI's motto is you're not alone and you're not to blame, and you will be well with help. And the help is available. These are treatable. And, there are wonderful resources out there. There are wonderful people practicing that can help, but it can take some time and effort to find that right person, that right fit for you as well.
Right. And Postpartum Support International can help you find somebody. We have people all over the world.
Yes.
It's really cool.
Yes, it is. They have coordinators in every state and around the world in all these countries, and you can, contact the coordinator in your area. They can help you find people who have been trained, who do know something about this, and it's a great place to start if you, especially if you don't know somebody in your community. Also, as Pec mentioned, and as we mentioned in our Simple Solutions, regroup therapy is online. I know they do have some specialists in perinatal mood disorders. You work with them, don't you?
Yes, I do.
Pec works with them too. See, so you can contact her through them as well. And also, and just, again, be willing to ask the questions, be willing to reach out for the help, I think is a big, important point of what we're saying here too.
And finding that on your website, you've got great resources. On my website, I've got resources.
Yes.
But one quick example is about placenta encapsulation.
Mm-hmm.
There's a lot of talk about that, and I really want people to know there's not been one study about humans eating placenta and mood. And it's gotten a lot of publicity, and movie stars are doing it, and people are endorsing it, and probably it can't hurt you, but there's not been any evidence yet that it helps. And we do know there's extensive research about things like exercise and psychotherapy. There's been some research about acupuncture and depression, about vitamin D, the sunshine vitamin. Most of us are deficient depending upon where you live.
Right, so, fish oil, omega-3s.
Omega-3s,
mm-hmm.
with what the research says really works. And on the placenta website, there is a page of research, and that one of those studies is about humans eating placenta and mood.
Okay, good to know. And, this is the world we live in. There's tons of information, but that doesn't mean it's all good. And so,
or accurate.
Yeah, or accurate. And it is important to weed through to the accurate research that helps us, and the accurate information that's really going to help you. And again, we've just touched on the main sort of ideas for treatment, and we have no more time to go into more, but there are other methods. Massage can be helpful, acupuncture can be helpful, like we were saying, omega-3s in fish oil, that's been studied. And there are other things like Pec's talking about. The placenta encapsulation is, obviously saving your placenta, having it put into capsules and ingesting it. That's something that's popular, but it's not necessarily been backed up by the research. And there are other things like that, controversial things like progesterone that some people swear by, but it really makes most people feel worse. So it's sort of, you need to find what fits for you and make sure that you've got good, solid information, accurate information. Yes. So thank you so much, Pec, for coming and sharing all your wisdom. Well, some of a small portion, I'll say, of your wisdom on this topic. Because as we said, we can talk about so many more, and I know we'll be revisiting this topic over and over again in different ways. And, I did want to mention that, we've been talking about moms the whole time, but as we know, dads also can, all these things we talked about can apply to dads too. And it's estimated that in the U.S., up to 14% of dads or more experience postpartum or paternal postnatal depression as well. And if you want more on that, you can go look up our episode called In Praise of Fathers, in which we talked about postpartum depression and dads. And in the meantime, you can get in touch with Pec at her website at Pec, P-E-C, Indman, INDMAN.com. Or you can also find her fabulous book, Beyond the Blues, at beyondtheblues.com. And you can also find her through PSI's website, postpartum.net. And if you're interested in training in your area or any kind of resources that we talked about today, you can visit all those websites and find more information, as well as information on my website as well. So thank you, Pec.
Thanks, Christy. It was so fun to see you.
So fun to talk. And everybody listening, be sure to check out Regroup Therapy at regrouptherapy.com. And until next time, I hope you'll also remember to visit my website for more on all of the things we talked about today, and to check out my books, This Is How We Grow and Who Am I Without You? And if you go to Amazon, my new book on 8 keys to mental health through exercise, that is available for pre-order. So you can check that out as well. We talked about exercise today, and there's a lot of good resources in that book on that topic. But until next time, I hope you'll join us again, and I hope you will choose to grow with us through motherhood each week here on our Motherhood radio show. Everybody have a great week, and we'll see you next time. Bye-bye.